The topic of the tutorial is neck, in which superficial and deep fascia will be done. I, Dr. Alpana Kesar, will be doing the topic under the following subheads: superficial fascia, in which platysma, anterior jugular vein, and external jugular vein will be covered. Under deep cervical fascia, investing layer of deep cervical fascia, prevertebral fascia, pretracheal fascia, and carotid sheath will be done. Superficial fascia of the neck. Superficial fascia of the neck, just like superficial fascia in the rest of the body, is made up of loose connective tissue. It comprises of areolar tissue and the adipose tissue. Platysma muscle. Platysma is a large, thin sheet of muscle present in the superficial fascia of the neck. It is a remnant of panniculus carnosus. Origin of platysma is from the superficial fascia of thorax below the clavicle. The muscle ascends as a thin sheet in the neck and gets inserted in the lower border of mandible. Some of its fibers intermingle with the muscles of the face. Innervation of platysma muscle is by the cervical branch of facial nerve. Function of platysma is to tense the skin of the neck. Anterior jugular veins. These are the anterior jugular veins. Anterior jugular veins are present in the superficial fascia of the neck. They drain blood from the anterior aspect of the neck. Anterior jugular veins begin just above the hyoid bone. They descend in the neck in the superficial fascia, then pierces the investing layer of deep cervical fascia to enter the subclavian vein. Sometimes, instead of entering directly into the subclavian vein, the anterior jugular veins may join the external jugular vein and then enter the subclavian vein. The two anterior jugular veins are connected to each other with the help of a venous arch, which is called jugular venous arch, and this jugular venous arch is present in the suprasternal notch just above the sternum. External jugular veins. This is the external jugular vein which is present in the superficial fascia of the neck. Formation of external jugular veins. This is the retromandibular vein which divides into anterior and posterior trunks. The posterior trunk of the retromandibular vein joins with the posterior auricular vein to form the external jugular vein. Course of the external jugular vein. The external jugular vein descends in the neck superficial to sternocleidomastoid muscle, crossing it diagonally. Termination of external jugular vein is by piercing the investing layer of deep cervical fascia. The external jugular vein passes deep to the clavicle to terminate into the subclavian vein. The tributaries of external jugular vein are those veins that drain blood into the external jugular vein, and that includes the posterior external jugular vein that drains blood from the superficial areas of the back of the neck, transverse cervical vein, and suprascapular vein that drains blood from the region posterior to the scapula. Clinical anatomy of external jugular vein. As we can see in this visual, external jugular vein is superficially located in the neck. If there are knife injuries in the neck, even if it is not very deep, it can easily cut external jugular vein due to its superficial location. Moreover, we have previously learned that external jugular vein passes from superficial to deep. As it passes deep, it pierces the investing layer of deep cervical fascia. Where it pierces the investing layer of deep cervical fascia, in that position, the fascia is adherent to the external jugular vein. As a result, when the external jugular vein is cut in this location, the cut ends of the vessels do not retract, which is prevented by the adherent deep cervical fascia. This causes the air to enter the blood vessel, resulting in air embolism, which may result in the death of an individual. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Deep cervical fascia. Deep cervical fascia is present deep to the superficial fascia. This is the superficial fascia, and deep to it is the deep cervical fascia. Deep cervical fascia in the neck is very well organized to form four distinct layers. The four layers of the deep cervical fascia are investing layer of deep cervical fascia, which surrounds the entire neck like a collar. What we see in blue is the investing layer of deep cervical fascia. Prevertebral fascia is seen in pink. The prevertebral fascia surrounds the vertebral column and the muscles around it. Pretracheal fascia. Pretracheal fascia is what that is seen in yellow or orange. This fascia surrounds the viscera of the neck. Carotid sheath. Carotid sheath is present on both sides of the neck. It receives contributions from the other three layers, that is investing layer of deep cervical fascia, pretracheal fascia, and prevertebral fascia. And carotid sheath surrounds the neurovascular bundle of the neck. The four layers of the deep cervical fascia organizes the neck into four longitudinal compartments. The first compartment is the area surrounded by the investing layer of deep cervical fascia. It is the largest compartment and includes some muscles, and along with that also includes the remaining three compartments. Vertebral compartment. Vertebral compartment is that which is surrounded by prevertebral layer of deep cervical fascia. It includes the cervical vertebra and the deep muscles associated with the vertebra. The third compartment is the one which is surrounded by pretracheal layer and is called the visceral compartment. It is called the visceral compartment because it contains within it all the viscera of the neck, that is pharynx, trachea, esophagus, and thyroid gland. The fourth compartment is called the neurovascular compartment. This compartment is surrounded by carotid sheath and it is present one on each side. This compartment contains neurovascular structures that pass from the base of the skull to the thoracic cavity, which includes the internal carotid artery, the common carotid artery, internal jugular vein, and vagus nerve. This is the investing layer of deep cervical fascia. It is a translucent, glistening layer which encloses the muscles and the other structures of the neck. It surrounds the entire neck like a collar. In this visual, this is the investing layer of deep cervical fascia. Deep to it is present the pretracheal fascia, which surrounds the viscera of the neck. This is the carotid sheath that surrounds the neurovascular bundles of the neck, and this is the prevertebral fascia, which surrounds the deep muscles around the vertebral column in the neck. Investing layer of deep cervical fascia. It completely surrounds the neck like a collar. Its attachments are as follows. Posteriorly, it is attached to the tip of the spinous process of the 7 cervical vertebra and to the ligamentum nuchae, which is a ligament attached to the tip of the spines of the cervical vertebra. The right and the left investing layers of deep cervical fascia moves anteriorly and get attached to each other. There is no bony attachment anteriorly. Superiorly, the investing layer is attached to the external occipital protuberance, superior nuchal line, mastoid process, zygomatic arch, and the lower border of mandible. Inferiorly, the attachment is to the spine of scapula, acromion, clavicle, and to the manubrium of sternum. Investing layer of deep cervical fascia, which surrounds the entire neck like a collar, splits to enclose two muscles. This is sternocleidomastoid and this is trapezius. It splits again to enclose two glands, the parotid salivary gland, which is present here, and submandibular salivary gland present here. It splits again to enclose two spaces, suprasternal space, which is present above the sternum, and supraclavicular space present above the clavicle. The investing layer of deep cervical fascia forms the roof of two triangles in the neck, the anterior triangle and the posterior triangle. This is also called the rule of two for the investing layer of deep cervical fascia, that is, it splits to enclose two muscles, it splits again to enclose two glands, splits the third time to enclose two spaces, and then forms the roof of two triangles. Certain structures pierce the investing layer of deep cervical fascia. Some structure pass from superficial to deep, and other structures pass from deep to superficial after piercing the investing layer of cervical fascia. The structures that pass from the superficial to deep are external jugular veins and anterior jugular veins. Both these veins traverse in the superficial fascia, and at the time of draining they pierce the investing layer of deep cervical fascia to pass at a deeper strata in the neck and terminate into subclavian vein. Structures that pass from deep to superficial are the branches of cervical plexus that supply the skin of the neck, and these branches include the lesser occipital nerve, great auricular nerve, transverse cervical nerve, and supraclavicular nerves. All these four are the cutaneous nerves of the neck that pass from the cervical plexus to the skin of the neck. Prevertebral layer of the cervical fascia is a cylindrical layer of fascia that surrounds the vertebral column and the muscles that are associated with it. The muscles that are associated with it includes the prevertebral muscles, the scalene muscles, that is the anterior, middle and posterior scalene muscles, and the deep muscles of the back. Attachments of the prevertebral fascia. Posteriorly, it is attached to the ligamentum nuchae. Anteriorly, prevertebral fascia is attached to the anterior surface of the body of the cervical vertebrae from 1st to 7th cervical vertebra. Superiorly, it is attached along a circular line to the base of the skull. The landmarks on this circular line includes the basilar part of the occipital bone, jugular foramen, carotid canal, mastoid process, superior nuchal lines, and external occipital protuberance. Specialization of prevertebral fascia. As the brachial plexus and the subclavian artery pass from the neck into the axilla, an extension of prevertebral fascia forms a sheath around these structures and passes along with them in the axilla. This sheath in the axilla around these structures is called axillary sheath. So axillary sheath is an extension of prevertebral fascia. Pretracheal fascia. This is the pretracheal fascia marked in orange. Pretracheal fascia surrounds trachea, esophagus, and the thyroid gland. Anteriorly, it is present just behind the infrahyoid muscles. Laterally, it contributes to the formation of carotid sheath. The posterior part of pretracheal fascia is also known as buccopharyngeal fascia. Buccopharyngeal fascia separates the pharynx and the esophagus anteriorly from the prevertebral fascia. The anterior layer of the pretracheal fascia begins superiorly at the hyoid bone, and inferiorly it extends till the upper part of the thoracic cavity. The posterior layer of the pretracheal fascia, which is also known as buccopharyngeal fascia, begins superiorly at the base of the skull and ends inferiorly in the upper part of the thoracic cavity. The pretracheal fascia also forms a capsular enclosement of the thyroid gland, thus forming the outer capsule of the thyroid gland. This is known as the false capsule of the thyroid gland, which is attached above to the oblique line of the thyroid cartilage and below to the cricoid cartilage. Since the thyroid gland capsule is attached to the larynx at the time of deglutition, when the larynx moves up and down on swallowing, along with that, the thyroid gland also moves up and down, which explains why thyroid swellings move up and down on deglutition. Carotid sheath. This is carotid sheath. It is a layer of deep cervical fascia which is present one on each side. It is a tubular sheath which encloses the neurovascular compartment of the neck. Its extension is from the base of the skull above to the arch of the aorta below. Structures enclosed within the carotid sheath include the common carotid artery below and the internal carotid artery above. It also includes the internal jugular vein. Nerves included are the vagus nerve and the ninth and the 11th cranial nerves are also present in its upper part. Carotid sheath receives contribution from the investing layer of deep cervical fascia, from the prevertebral fascia, and also from the pretracheal fascia. Relations are ansa cervicalis is present in its anterior wall. In its posterior wall is present cervical sympathetic chain. Fascial spaces are the spaces which are present between the fascial layers in the neck. These spaces may provide a way or transit for the spread of infections from one part of the neck to the other and also from the neck to the mediastinum. The spaces that may be involved in the infections may be the pretracheal space, which is present between the investing layer of deep cervical fascia anteriorly and the pretracheal fascia posteriorly. This is the pretracheal space. This is the retropharyngeal space. Retropharyngeal space is present between the buccopharyngeal fascia anteriorly, which is the posterior layer of pretracheal fascia, and the prevertebral fascia posteriorly. So this space between the buccopharyngeal fascia and the prevertebral fascia is called retropharyngeal space. These spaces which are present between the layers of fascia, called fascial spaces, provides a conduit for the spread of infections in the neck. Questions that may be asked in the examination from the topic superficial and deep cervical fascia includes external jugular vein, anterior jugular vein, platysma, investing layer of deep cervical fascia, carotid sheath, pretracheal fascia, prevertebral fascia, fascial space infections, anatomical reasons for why do cuts in external jugular vein cause air embolism, why do thyroid swellings move up and down on deglutition.